Hi everyone and welcome back to the channel. My name is Nurse Mo, and on this channel we break down high yield nursing concepts and NCLEX strategies to help you pass your NCLEX with confidence. In today's video we're going to discuss NCLEX prioritization strategies, and this is because I've seen that prioritization questions are very common on the NCLEX and many students struggle with deciding which patient or which intervention should come first. In this lesson we'll go through 5 important strategies that can help you answer prioritization questions more confidently. But first, what is prioritization? Prioritization simply means choosing which patient to see first. It means choosing the most urgent intervention and above all focusing on patient safety. Normally as a nurse you can have multiple patients with different needs, so you need to decide at every point which of your patients need urgent attention or urgent intervention. You might even have just one patient, but that one patient might have different needs. So prioritization means deciding which patient or which patient's problem requires attention first. And on the NCLEX, these questions test whether you can recognize the most urgent need. You can recognize prioritization questions when you see words like best, words like first, like most important, words like initial action or immediate response, etc. So some of these strategies include the ABC rule. The ABC rule, as we all know, simply means airway, breathing, and circulation. The ABC rule is one of the most important strategies for prioritization questions, and to be honest, NCLEX loves to test this. For example, if you have 4 patients who are calling you for help, you have a patient who is choking on food, a patient asking for pain medication, a patient with stable fever, a patient waiting for discharge instruction. Using the ABC rule, who do you see first? Of course, you see the patient who is choking because airway is the highest priority. Then after airway comes breathing. If a patient is having difficulty breathing, it's also urgent because when a patient is not breathing well, oxygen is not getting to the body, right? Then you have your circulation next, because problems like severe bleeding or shock will affect blood flow and can be life-threatening. So how do you know this? When you have a question that will require you to use the ABC rule, simply eliminate the wrong answers first. Focus on who is actually in danger. Airway first, then breathing before circulation. Okay, that's for the ABC rule. Then the second rule that we can use to answer questions on prioritization is the Maslow's hierarchy of needs. In the Maslow's hierarchy of needs, we have physiological needs which come first before other needs like safety needs, belongingness and love needs, esteem needs, self-actualization needs. So this Maslow's hierarchy, as we can see, is in a pyramid format, and you see this arrow on the left shows the priority from the lowest priority to the highest priority. And in Maslow's hierarchy of needs, physiological needs come first. Physiological needs like food, like water, like rest, like warmth, like oxygen, these are physiological needs of the body, and you have to meet these needs first before talking about other type of needs like the safety needs, the belongingness, the self-actualization, and the rest of it. For example, you have 3 patients, a patient with oxygen saturation of 82%, a patient who is upset about visiting restrictions, a patient asking for their next meal. Who do you think should come first? Of course, it's the patient with low oxygen, because physiological needs always takes priority. Now, this second option, a patient that is upset, is talking about maybe belongingness and love needs, because the patient is upset about visiting restrictions. Maybe relatives are restricted from visiting the patient, or maybe there is a strict visiting hours. So that one is talking about belongingness and love needs, which take lesser priority to physiological need like the oxygen saturation. The third strategy is the acute versus chronic. Acute conditions will always take priority over chronic conditions. An acute condition is simply a condition that occurs suddenly and it can be life-threatening, but a chronic condition develops over time and is usually more stable. NCLEX loves these distinctions, knowing the difference between acute and chronic conditions. Now, an example that will probably help you understand it is sudden chest pain, shortness of breath, can be classified as acute condition, whereas a patient with diabetes and has high glucose is a chronic condition because it is not sudden, it is predictable, right? So in this example, we already see sudden chest pain. The word sudden already makes it not predictable, so it's simply an acute condition. Another key strategy in prioritization is determining if a patient is stable or unstable. Now, there are different key factors that might make a patient stable or make a patient unstable. NCLEX loves to test this particular concept. Now, unstable patients have abnormal vital signs, they have sudden symptoms or rapid changes, and these patients require immediate assessment, immediate intervention, whereas stable patients have expected findings or conditions that are not life-threatening. In stable patients, the vital signs are usually stable. The symptoms you see in stable patients, even though they might be serious symptoms, but they are predictable. You already know that these symptoms will come with the patient's conditions, but when you have sudden symptoms, it automatically makes the patient unstable. Predictable symptoms make patients stable, while unpredictable symptoms make patients unstable. Then change in condition. If a patient has a sudden change in their condition, maybe a sudden decline in some of the parameters, their vital signs and other parameters, it makes that patient unstable. Whereas if a patient's condition has been stable over time, if it has been predictable, it has been the same, it has remained unchanged over time, it means the patient is stable. So you need to be able to identify what makes patients stable and what makes them unstable. An example of this is when you have 4 patients. Patient A has normal vital signs and is recovering post-op. Patient B has a blood pressure of 80/50 with new confusion. Patient C is asking for water, and patient D is ready for discharge. In these 4 patients, amongst them, who do you see first? Who takes priority? Of course, it's the patient B with a blood pressure of 80/50 and a new confusion. A blood pressure of 80/50 is already a circulation problem. Remember, we talked about the ABC rule, right? It's already showing that enough blood is not going through the body. Maybe the tissues aren't even getting enough blood due to the low blood pressure. And then it also tells you that this patient has new confusion. The key word there is new. The word new already tells you that the patient was not confused before. It is a recent development, so this particular patient will take priority. Now, the next strategy is the nursing process. In the nursing process, we have assessments, the diagnosis, the planning, the intervention, and the evaluation. An acronym we know as ADPIE. Yes, that's the acronym I've always known it with. So the nursing process is another tool for prioritization, and it includes these 5 elements that I mentioned. And NCLEX often expects you to follow this process in answering your questions. Generally, assessment comes first because you need information before you act. You cannot intervene or diagnose a patient if you've not done an assessment. But remember as well that if the patient is in immediate danger, please intervene first. This rule of assessment first might not apply in every case, especially in life-threatening or emergency conditions. If, for example, you come and then see a patient who is bleeding profusely, you don't begin to assess the patient, maybe assess how much blood they are losing, or start doing skin assessments, hair assessments, and all of those assessments. You intervene first in emergency conditions, in life-threatening conditions. Otherwise, please, assessment always comes first. So following nursing process, we assess first. Unless the patient is in critical danger, then we act immediately. For example, if you have a patient reporting dizziness, what do? A, give IV fluids immediately. B, access vital signs. C, call the doctor. Using the nursing process, your answer is option B, access vital signs first. You assess vital signs in order to identify what is causing the dizziness. It could be how they are positioned on their bed. It could be because they've not eaten. You need to assess to find out why this patient is having dizziness. And we assess in this case because the patient is in no immediate danger. We assess, we check the blood glucose levels, we assess the vital signs, we do head-to-toe assessment, we ask questions. These are things we do first before we go ahead to intervene, because it is not an emergency. But if it was an emergency, let's say in the case of bleeding, you don't start assessing, you give IV fluids, you try to stop the bleeding, you intervene before assessment. Interventions will come first before any forms of assessment. Okay, So we have practice question here for you to attempt. I love this part. Please attempt this question and let us know your answer in the comment section. The nurse is beginning a shift on a medical surgical unit. Which patients should the nurse assess first? Option A patient with pneumonia who has an oxygen saturation of 88% on room air. Option B, a patient who had surgery yesterday and is requesting pain medication. Option C, a patient with diabetes whose blood glucose is 240 mg per dl. And option D, a patient who is being prepared for discharge. So attempt this question using the strategies we've listed in this lesson and let me know your answer in the comment section. Finally, here are some NCLEX tips for you to remember. Whenever you feel stuck on prioritization question, just ask yourself, what will keep my patient the safest? Is the patient's airway compromised? See, prioritize life-threatening conditions. Is patient having difficulty breathing? Is the circulation affected? Then when you answer these questions, you combine them with Maslow's hierarchy of needs, stable versus unstable, and all these other strategies that we mentioned. And it will help you eliminate incorrect answers and choose the safest intervention for your patient. Finally, learn to think like a new graduate nurse. What do I mean by this? New graduate nurses often follow textbook practice of care, textbook standard of care, and this is what NCLEX expects of you. Do the right thing, because in some cases the practice that are obtainable in hospitals might not be the proper standard of care. So follow what you know is right to do, what you know is the appropriate standard of care, appropriate thing to do without improvising. Do the right thing and answer questions using textbook standard. All right, so thank you for watching till the end, and I hope this review or this lesson helped you to understand NCLEX prioritization strategies better. And please, if you found this helpful, make sure to subscribe, because I'll be sharing more high yield NCLEX topics and practice questions in upcoming videos. See you in the next video. Bye.